We're still at least months away from a vaccine for COVID-19, but this afternoon, the FDA approved remdesivir as a coronavirus treatment. But recently, President Trump claimed there's already a cure.
But not so fast, say doctors and experts who agree there's potential, but also possible risk. 7 investigator Ross Jones is live tonight in Detroit with more on this therapy for COVID-19. Ross?
Carolyn Allen, good evening. This treatment has not been approved by the FDA. If you're a patient, like at one of the hospitals behind me, you can't get it. But the president has already said this is a cure. Should we believe him?
President, I'm the moderator of this debate, and I would like you to let me ask my question.
The last time the president took to a debate stage, he was contagious with COVID-19. Days later, he would have to be hospitalized at Walter Reed Medical Center, suffering from fatigue, fever, and low oxygen levels. But the president did recover, and he said he knew why.
Within a very short period of time, they gave me Regeneron. It's called Regeneron.
The drug is actually manufactured by Regeneron, who's producing an antibody cocktail that it hopes will help trigger an immune response to COVID-19.
It's a cure. For me, I walked in, I didn't feel good. A short 24 hours later, I was feeling great. I wanted to get out of the hospital. And that's what I want for everybody.
The president is not a doctor, but even before he was treated with Regeneron's experimental cocktail, plenty of doctors were optimistic about its potential. Last month, the company announced that in a small study of 275 volunteers, it appeared to reduce recovery time in COVID patients and lessen virus levels, too. Even Dr. Anthony Fauci said on MSNBC recently that the Regeneron therapy may have helped the president.
There is a reasonably good chance that that, in fact, made him much better.
But is it a cure, as the president said? The short answer is no.
Nothing is a cure. Even in the small reports that are out there right now, it didn't prevent it in everybody. It just decreased the incidence.
Dr. Jason Pogue is a clinical professor of pharmacy at the University of Michigan and the president of the Society of Infectious Diseases Pharmacists.
Optimistic early data is good. It's good to be optimistic in a situation, but that needs to lead to robust, larger clinical trials. And that's what we really need to see if what we hope from some early data actually pans out.
And the president has made other statements about the Regeneron therapy that just aren't true.
We have hundreds of thousands of doses that are just about ready. I have emergency use authorization all set, and we got to get it signed now, and you're going to get better.
Actually, this month, Regeneron said it only had about 50,000 doses in stock. And while the drug could be made available through an emergency use authorization, it has not been yet. And most importantly, we still don't know how well, if at all, the drug may work.
This is not a treatment that is standard available to everybody out there. It is only truly available as part of experimental therapies in very controlled settings.
Dr. Roberto Colon is the Associate Chief Medical Officer at Miami Valley Hospital in Dayton, Ohio, which last week began enrolling patients as part of a wider study of the antibody therapy.
Everybody wants to get better, and we wish that we were able to give everybody treatment that we know works. But part of this is trying to uncover how much these treatments work and how safe they are.
And even though the president credits his recovery to Regeneron, experts say there's no way we'll know if that's why he got better. But this much we can say for sure. It will be months before we know whether the therapy works. And if it does, months more before it'll be widely available. In the meantime, heed this warning.
There's a lot of misinformation that goes out there, and I think the key is to listen to the scientists, listen to the clinicians. We will direct to where the information tells us.
Now, Regeneron has asked for an emergency use approval that would allow them to give some patients this drug, even though it has not been approved by the FDA. So far, they're still waiting for an answer. We're live in Detroit tonight. I'm Ross Jones. 7 Action News.
Wow, a lot of good information, Ross. Let me ask you a quick question, and I don't even know if you can answer this. So did the president get like one shot with Regeneron? Did the researchers there tell you what exactly is it? Is it just one shot?
Based on what the White House released, he got one injection of this, and he says that's all he needed, and he believes that's what cured him. But the doctors that I talked to said, let's be very clear here. Obviously, he got better, but we'll never know if that's the reason he got better, if he would have gotten better on his own, or if any of the other treatment he got is the reason he turned around so quickly.
Yeah, and bottom line, like you said, we have to listen to the scientists and wait and see when the research comes about.